Did you know that heart disease is the leading cause of death worldwide? Cardiologist Dr. Chua joins us to debunk common myths about heart disease and the connection between weight and heart health. Before we dive in, let me know in the comments where you're watching from and if it's your first time joining us. Dr. Chua, thank you so much for being here with us.
So it's a pleasure to be here, Ainsley.
Is there a direct connection between weight and heart disease?
There is a connection. So in fact, if you are overweight or have excess fat tissue, it is related to disease. So we know that for every 5 kilograms per meter squared over 25 in your body mass index, there's about a 30% increased risk of mortality, of dying. And 2/3 of that is related to cardiovascular disease. So there's definitely a connection between being overweight and heart disease.
So what are the heart conditions that obesity increases our risk for?
So if you have excess fat tissue that's deposited in the wrong places, okay, so we're not talking about all fat, we're talking about inflammatory fat, then it can cause a whole host of disease. So not only does it increase the risk factors of diabetes and high blood pressure, high cholesterol, but also it can directly cause irregular heart rhythm. For example, that's called atrial fibrillation. It can also cause plaques to form in all of your arteries, whether it's in your heart or in the arteries to your brain, that can cause heart attacks and strokes. And the last thing is it can stiffen your heart and cause heart failure. And lastly, there's also patients that are significantly overweight can also have sudden death because of ventricular arrhythmias.
So what is it about carrying excess weight that makes us more vulnerable to heart issues?
Let's go over first about the excess weight and what it does to our body. So carrying the excess weight can cause, it's harder to breathe, first of all, to expand your lungs. And it's also patients who are overweight, they have a harder time exercising and have what we call decreased exercise capacity. And so that actually leads to not exercising as much, or it's harder to exercise, and that can lead to heart disease, right? It's a sedentary lifestyle. But not only that, as that inflammatory fat tissue that's deposited around organs, so most of it is accumulated in the abdomen, but it can also accumulate around the heart, right? And when that happens, it can cause heart disease.
So an endocrinologist told us recently that when it comes to fat tissue, it's all about location, location, location. And I think that's what you're alluding to. Tell our audience why where fat tissue accumulates really matters and why.
Well, we all have fat cells, right? So and some fat is healthy fat. We need fat that stored in our bodies for like emergency situations when we actually do need extra fat fuel to burn. However, if we store fat that is in excess of that storage capacity, then it gets stored in abnormal places, so location. So it can go around the tummy, right? This is what we call visceral adiposity, but it can also occur around the organs. For example, liver. In the liver, it's fatty liver. It can go around the kidneys, it can go around the pancreas, and lastly, around the heart. And around the heart, depending on where it's located around the heart, it can cause different types of heart disease. So if it's located around an artery that supplies the heart, it can cause plaques or hardening of the arteries, and those can rupture and cause a heart attack. If it's located in the top chambers of the heart, it can cause scar tissue in those areas and can cause irregular heart rhythm called atrial fibrillation. And lastly, if it's around the muscle of the heart, it can actually cause stiffening or fibrosis of the heart. And if your heart is stiff, it can't relax properly. The pressure builds up inside the heart, it gets transmitted to the lungs, making you short of breath. And if it gets severe enough, it can actually go into your legs and get swelling of the ankles, and you will be tired and short of breath.
We're going to pause here and do our trivia question. If you answer our question tonight, folks, you'll get our dietitian's 5 tips for heart-healthy eating. All you have to do is answer our trivia question, which is, true or false, obesity is associated with over 200 other health conditions. Is that true or false? Is obesity associated with over 200 other health conditions? Put your best guess in the comments, and you'll get that guide delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. So we've talked about weight loss. How do other factors like stress or genetics or what's happening in our lives also impact cardiovascular health?
We do know increased stress does increase your risk for heart attacks, for example. If you have a sedentary lifestyle, I think this is one of the biggest things, like exercise really, really does lower your risk for heart disease. Genetics, yes, for sure, we cannot change your genetics, but it's important to know what your genetics are, right? So if you do have a family history of heart disease, it's actually important to delve into that, to realize what your risks. So the key to heart health is prevention. And so if you know ahead of time you have a family history, delve into that family history so you understand it and you know how to change your risk. You can't change the family history part, but you can change the other risks for heart disease to prevent heart disease.
So if we know we have a family history, is that something we want to let our doctor know about?
Absolutely, because your doctor can then guide you into what to look out for. There's so many types of genetics involved in heart disease, some of them related to blockages in the arteries, but there's also others related to heart muscle and arrhythmias and so forth. So it's important to know what type. And a lot of patients think, yes, I have a family history of heart disease and stop right there, but they don't delve into the specifics. And the specifics really help us to tell you what to look out for.
So one question we often get from our audience is it possible to have obesity and still have a healthy heart?
Yes, in a sense, because it all depends on where that fat is located. So it's possible to have fat stored in healthy places, such as in your thighs, right? That is used for energy and be healthy. And if the fat is stored in abnormal places and causes inflammation, that makes you unhealthy. So it depends on how you define overweight, right? So a lot of people define it by the weight and height or body mass index. And I think although that is good for screening purposes, it's not the be all and end all because it can often lead us to misdiagnosis because the body mass index looks at both fat and lean mass, right? So lean mass being bone or muscle. But if you do have increased fat distribution of unhealthy fat, then that correlates to heart disease.
So actually, that was my next question for you, which was, is BMI an accurate representation of heart health for everyone?
No, it is not. It's a good screening tool for sure, but you can be misled by it, right? So there are people that we think, oh, they look fairly thin, right? But there's actually fat inside of them, unhealthy fat inside of them, around their abdomen or wrapped around their organs. And then there are some people that their body mass index is higher and we think, oh, they are overweight, therefore they're unhealthy, but that's not the case because a lot of the weight may be muscle mass, maybe bone mass, right? And they don't have a lot of that unhealthy fat wrapped around their organs.
Are there certain ethnicities for whom BMI is a particularly unreliable measure?
So we do find that Asians and Southeast Asians carry more of that undetected inflammatory fat. And also with Asians and Southeast Asians, we're kind of tinier, so our bone mass and our muscle mass may not be as high as, say, Europeans or North Americans. The other population to look out for are elderly. So elderly people usually lose muscle mass. Right? So their weight may reflect more fat accumulation. So therefore, you have to watch out for the elderly as well.
Is there another measure besides BMI that you recommend people look at?
So there are other measures. Again, though, not every measure is perfect. So I think the more measures you can get, the more conclusions you can draw by. So one of the things is waist circumference, because a lot of the unhealthy inflammatory fat accumulates around the waist. So waist circumference is a good tool, and then comparing it to your height. So the waist height ratio should be less than 0.5. So those are just rough averages. If it's more than 0.5, then it usually means that there might be an increase in that inflammatory fat. But again, it's not a perfect measure. and you have to be careful in how you measure it. The other thing is sometimes high triglyceride levels can be another sign of there being abnormal accumulation of inflammatory fat.
So, if someone is concerned that their weight is impacting their heart, what are the questions they should be asking their doctor?
They should definitely be asking about risk factors for heart disease, right? So weight is a risk factor for heart disease, but there could be other things that can impact their risk of getting heart disease. So those include, do they have any high blood pressure issues? Do they have any diabetes or pre-diabetes, high cholesterol? Do they smoke? Smoking is a big one that you can cut off. And then family history, as well as stress and sedentary lifestyle. And then if you're going to look into lifestyle issues, so one is getting a very good diet, and then also exercise. So sedentary lifestyle adds to heart disease. So we recommend about 150 minutes a week at moderate levels of cardiovascular exercise. So we're not talking about window shopping, Ainsley. We're talking about a good 20 to 30 minutes at a time where you're actually doing aerobic exercise. So whether it's a walk, a brisk walk, a run, biking, swimming is a wonderful exercise, especially if you have joint issues, because it doesn't impact your joints as much. So that's what we're saying, 150 minutes of that does wonders for both helping the risk factors and decreasing heart disease. As well, I think we should also be doing, as we age, we should also be doing resistance exercises. So we recommend about 2 to 3 times a week to do some resistance exercises that prevents muscle loss. So as we age, we really need to maintain our muscles. And if we do lose weight, we lose both fat and muscle. So it's easier to gain back the fat than the muscle. So we need to maintain our muscle mass.
Dr. Chua, can reaching a healthier weight now help prevent heart issues down the road?
Absolutely. If you're starting out, you need to maintain your weight at a good level, because it's not so much how much weight there is, but it's how many, I like to say, how many years have you been exposed to that risk factor, right? So we talk about smoking years, we talked about lipid level years, or how long has your arteries been bathed in bad cholesterol, high bad cholesterol. So now, how many years has your body been exposed to that risk factor of inflammation from the fat adiposity or fat cells? So really, if you want to maintain a healthy heart, it's all about prevention. So start early, keep your weight where it should be. I always say monitor your weight, because it's easier to lose that few pounds than actually to lose it when it's 20 or 30 pounds. So really watch your weight.
So how much weight do we need to lose to improve our heart health?
So it depends upon what you want to target. So if you want to target risk factors like high blood pressure or high sugar levels, about 5% of your body weight. If you want to target high cholesterol and actually preventing diabetes, so weight loss can actually prevent diabetes if you are in the pre-diabetes range, we're talking about 5 to 10% of your body weight. If you're going to look at coronary disease or blockages of the arteries, you're talking more like 10 to 15% of your body weight. And then if you want to talk about heart failure or preventing death from cardiac causes, we're talking about over 15% of your body weight.
Are weight loss medications an option you explore with your patients, not only to reach a healthier weight, but also to improve cardiovascular health?
Yes, I do. And we have had the benefit of actually getting now really good weight loss medications that actually does prevent heart problems. In the past, we did not have that option. So now we're getting into the territory where we can get 10 to 15% weight loss, and with more research, we can get even more. Where we're approaching sort of surgical or bariatric surgery levels. And these medications are wonderful because it's not only weight loss, it's targeting the root of the disease, targeting the inflammation in the fat cells. So with that, we have seen improvements. So prevention of heart attacks, prevention of or improving the way a patient feels when they have heart failure, improving their ability to exercise more, improving their quality of life. And when we measure things such as inflammation in these studies, we also see a significant drop of inflammatory markers. So we know that these medications do target where it needs to target to prevent disease, or to help disease.
And do you refer your patients to see a weight management or obesity specialist in order to kind of assess whether the medications are the right tool for them?
So I'm very comfortable in prescribing these medications, and I've seen great results from them for my patients. So I do prescribe myself. However, there are other specialists that are not as comfortable, and if they want to get their patients on these medications, then yes, this is a great way. We work as a team, as teams, a great way to refer your patients to a specialist that has had training with obesity management.
In case you're just joining us, we're here with cardiologist Dr. Grace Chua, separating myths from facts about heart disease. And we're giving away a guide with 5 tips for heart-healthy eating if you answer our trivia question, which is, true or false, obesity is associated with over 200 other health conditions. Is that true or false? Is obesity associated with over 200 other conditions? Put your best guess in the comments, and you'll get those tips delivered to your Facebook Messenger inbox for free. Folks, we do this show every month, and we want to make sure you never miss an episode. Be sure to like and follow us on Facebook for updates about new episodes. So, Dr. Chua, I have a few questions for you about men. Are men with obesity at higher risk for heart issues, or are their risk levels similar to that for women?
Everyone is at risk with obesity, but when we actually look at population studies, women seem to have a higher risk of having a bad outcome than men and with obesity. So I think it's because of a couple of factors. Women tend to be protected from heart disease in the premenopausal stage, but once they hit menopause, the risk dramatically goes up, right? And then so we also see the risk of developing obesity, accumulating more fat around the waist and around the organs to skyrocket after menopause. And whether that's related to hormonal issues or other factors, it's unclear.
So I think there's more and more news about alcohol, and it seems like the scientific consensus about whether it's good for us or not is changing. How do you advise your patients about alcohol and the impact it has on heart health?
So you're absolutely right. In the past, when I just started medical school, I would say to patient, if you're target 2 drinks a day, 14 drinks a week is fine. But now more and more research has found that any alcohol at all may be detrimental to your heart health. So what I say to my patients is try and avoid it. I'm not saying cut it out completely. If you're going to have a social occasion, you can drink, but I would not make it as part of a daily habit, because it does accumulate. In larger amounts, it is a direct toxin to the heart and can weaken the heart. But even in little amounts, it can increase most of the cardiac risk factors and increase that accumulation of inflammatory fat.
So we know that erectile dysfunction can be an early warning sign of heart issues. Can lifestyle changes and weight loss help address this concern?
Absolutely. We know that it's affected by high blood pressure, erectile dysfunction, as well as high sugars, anything that affects blood vessels, basically. If your blood vessels are unhealthy, one of the first places shows up is erectile dysfunction, because the blood vessels that are down there are very small, right? And so if you have risk factors, it will affect that. So we do know that if you are able to control your risk factors, including weight loss, that it does significantly improve erectile dysfunction.
So we know that men are less likely to be proactive about their health. If someone watching is concerned about a man in her life, how would you suggest they start the conversation?
I would say the first thing is, if they will allow you, go with your partner to the physician and listen to what the physician has to say to them. Oftentimes, I will get a patient and be telling him certain things, and it doesn't translate at all, and nothing translates back to their partner. And so when their partner does come, they are totally surprised by what's going on. So I think there's a component of denial, a lot of us, but I do find more so in men, sorry guys. So if you are concerned, and it's vice versa too, with wife, or if you're a man, worried about your wife, please go to their doctor's appointments, get what the lay of the land is and what they should be doing, and then help from there, encourage, right, or change what's going on at home, encourage exercise. And if you're the cook in the house, change the diet, because it's very easy. Our environment is made for us to actually gain weight, okay, and not the good weight, the inflammatory fat. And so that change is always better made not by one person, but the household. And so those are things that, and encouragement as well is really important, because oftentimes it's hard to do it alone. You get more success when there's somebody else there with you.
So what's one piece of advice you'd like every viewer to remember about taking care of their heart?
The biggest piece of advice is to start early. Don't start when you already have the disease if you can help it, but start early, and that starts with prevention. As we age, we develop risk factors of heart disease, and firstly, knowing that you have them or are prone to developing them is very important. So go see your physician and make sure you know your numbers. And if you are trending that way, it's easier to reverse it at the beginning than when you've already developed it and developed disease. So there's more pain in the later stages if you want to reverse it. So try and prevent it from the start. So know what your heart is like, and know what are the risk factors that can affect your heart, and work hard to prevent it.
Dr. Chua, thank you so much for joining us tonight. This has been such a helpful conversation.
It's been a pleasure, and it's great talking with you and to your audience. I hope this has helped everyone.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, obesity is associated with over 200 other health conditions? The answer is true. If you didn't get to answer the trivia question, but you'd still like those helpful tips, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.